This video is the fourth in a series developed by Alberta Health Services to support frontline staff in early disclosure conversations. The Alberta Health Services Disclosure of Harm procedure requires that if there has been any harm, there is any potential for future harm, or if there will be any change in care or monitoring because of something that has happened in our delivery of care, we must have a conversation with our patients. We call this conversation disclosure. In this video, you will see an early disclosure conversation where we will not know whether the care we provided contributed to the patient outcome until we have investigated further. We do know the patient has had an unfortunate outcome and deserves a discussion. The focus in this type of conversation is to empathize with the patient and family. It is important that we acknowledge and apologize for the situation, but that we do not speculate. Providing an explanation to the patient will require investigation and further conversation. Because this is a pediatric case, it is important to address both the child and the parent in the conversation. I would like you to listen for the key elements that should be included in a disclosure conversation: an apology, an explanation of what has happened, and an explanation of next steps and any future implications to the patient.
Hi, Alex and Kate. Do you remember me? I'm Dr. Keith, the one who ordered all those tests to figure out why you're feeling so sick. Jacinta and I are here to discuss the results.
Hi, Kate. Hi, Alex.
Hi.
So, Alex, I heard you had some medicine for your pain. Earlier, you rated your pain as a red. How would you say your pain is now?
I'm feeling okay.
How about you, Kate? Have you noticed any difference with Alex since we were last here?
I know she's feeling better, but she still looks so pale. I'm still concerned something just isn't right.
I know, and that's why you brought her back to see us again. Thanks for doing that. You absolutely did the right thing.
Thanks for saying that.
Well, the ultrasound results are back, and it looks like Alex has appendicitis. It appears as though her appendix is perforated. Do you know much about appendicitis?
No, not really.
Well, Alex, the appendix is the size of your baby finger. It's inside your tummy. And you can be normal and healthy without your appendix, but sometimes your appendix can get sick, and we call that appendicitis. Over time, it can break open, and we call that a perforated appendix. This is what's happened to you.
I just can't believe we were here yesterday and they sent her home so sick. The doctor didn't even do any tests. And now we're back today and you're telling me it's appendicitis and her appendix has burst?
I'm really sorry. It must feel frustrating to find out that your daughter has perforated appendix and to wonder if this diagnosis could have been made sooner. Can you tell me about your visit yesterday?
Yeah, I brought Alex in to have her assessed. The doctor checked her. He really made me feel like it was nothing more serious than the stomach flu. Certainly didn't mention appendicitis. He did say that if she got worse that I should bring her back, and this morning there was just no question that we had to come back. Are you telling me it's been appendicitis all along?
I know that you're really concerned when you were here yesterday. Appendicitis is a process that can evolve over time. Occasionally, it's difficult to make the diagnosis early, especially in children. I know you had a rough night. Alex got sicker through the evening, and you brought her back for her to see us here today. It's not uncommon for there to be a perforation with appendicitis, and most children still recover quite well from that. We take all visits to the emergency department seriously, especially when patients return with worsening symptoms like Alex. In situations like this, we often review the case to see if there's opportunities for us to have made the diagnosis earlier. I think we should do that with Alex's case.
I definitely think this case needs to be looked at.
Would you like us to share those results with you?
I would like to know what you find, but right now I'm just really concerned about Alex. What do we do now?
Well, we're going to focus on making you comfortable now, Alex. It's important to know that you can't have anything to eat or drink, and we're going to give you some special medicines through the IV tube called antibiotics. And you're going to meet another doctor, a surgeon, and he's going to talk to you about the best way to treat you. Usually appendicitis is treated with surgery, but sometimes we give the antibiotics some time to work first. The surgeon will talk to you about the best path going forward. Do you have any questions or concerns right now?
I can't think of any right now, but I'm sure when my husband gets here and we have a chance to meet with the surgeon, we'll have some questions. Alex, sweetie, do you have any questions?
No.
Alex, I'm really sorry you've been feeling so sick the past few days while we try to figure out what's causing it. The good news is we figured it out now and we can focus on making you feel better. If there's any questions or concerns, please tell Jacinta and she can come find me right away.
Alex, we'll be starting you antibiotics medication in a few minutes, and you shouldn't feel anything at all.
Thanks.
It is important that all disclosure conversations are documented in the patient's medical record by the person who leads the discussion. In the Alberta Health Services Disclosure of Harm procedure, there are 12 key elements that should be documented. We hope this video helps you to feel more comfortable in having early disclosure conversations with your patients. There will be times patients suffer harm and we don't yet understand whether care provided contributed to the unfortunate outcome. We may not have even been directly involved in earlier aspects of the patient's care. It is important we start the disclosure process early. We can acknowledge and apologize on behalf of our healthcare team without speculating, recognizing that further conversations will be necessary. You can get more information and support by accessing Alberta Health Services disclosure resources.